Welcome to Clinical Crash Course. Listen up. Today's mission is a high-speed takedown of two specialized vascular syndromes. This is all about anatomy, pressure, and flow.
First target, Leriche syndrome. We're talking aortoiliac occlusive disease, right at the bifurcation. The key is the triad. Second target, subclavian stele. This is a critical blockage proximal to the vertebral artery. Here, it's all about the stele.
For Leriche, you are hunting for the triad: buttock and thigh claudication, erectile dysfunction, and absent femoral pulses. And for the stele, blood is literally diverted from the brain, flowing backward down the vertebral artery when the arm is used. You're looking for a BP gap over 15 millimeters of mercury between the arms, plus vertebro-basilar symptoms like syncope. Know the triad, spot the stele, save the flow. Let's go.
All right. Before we dive deep, we engage our mandatory international medical disclaimer.
This content is for educational purposes for international boards only. It is not medical advice. Always consult official guidelines and a specialist physician for clinical decisions.
Sarah, back in Module 3, we covered your standard PAD. Usually atherosclerosis down in the calves. But Leriche syndrome, this is a whole different ballgame. A far more proximal blockage with a very distinct presentation.
So let's break it down. Why does this high-level occlusion, right at the aortic bifurcation, produce that specific triad of symptoms?
It's a total distribution disaster, Dr. Collins, because the blockage is so high up at the distal aorta or common iliac arteries, it basically chokes off the blood supply to the entire lower half of the body.
So the buttock and thigh claudication, that happens because the internal iliacs are completely starved of blood. The absent femoral pulses, well, that's just a direct mechanical result of the block. But here's the one that's most important for the boards: the impotence, or erectile dysfunction. That's because of decreased flow to the internal pudendal artery. So remember this clinical pearl. If you see a smoker with hip pain and ED, it's Leriche until proven otherwise.
Precisely. Now that we've got the triads down, let's move superiorly up to the neck for a true masterclass in hemodynamics: subclavian stele syndrome.
Okay, Sarah, the classic presentation here is vertebro-basilar insufficiency. So tell me, why does simply exercising the left arm cause the patient to feel dizzy?
It's all a pressure gradient issue, Dr. Collins. It's physics. If that proximal subclavian artery is blocked, the arm is desperate for blood from somewhere else. So it steals it right from the vertebral artery. So the blood actually reverses course. It flows backward, down the vertebral artery, away from the brain and into the arm. And when the patient exercises that arm, the demand for blood skyrockets, sucking even more blood away from the posterior part of the brain. And that is what leads to vertebro-basilar insufficiency. We're talking syncope, vertigo, even visual changes.
Outstanding. And for a really key diagnostic clue, the 2024 ESC update really emphasizes the BP gap. Sarah, what's the threshold we're looking for? A systolic BP difference over 15 millimeters of mercury between the arms. And remember, the affected arm always has the lower pressure. If you see that gap combined with CNS symptoms on exertion, you found the stele.
Spot on. And for the top score question, what is the first-line diagnostic test? That's going to be duplex ultrasonography of the neck and subclavian vessels. It'll show that classic hallmark sign, retrograde flow in the vertebral artery. For treatment, we start with lifestyle changes, but if the symptoms are severe, we're looking at stenting or even bypass surgery.
You know that BP gap is such a powerful clinical clue, which brings me to our question of the day for all of you. Have you ever actually caught a case of subclavian stele just by being diligent and noticing a significant blood pressure difference between the left and right arms? It's a great reminder to always check both. Let us know about your catches down in the comments.
Sarah, it's time. Lock the special signs.
Leriche is the triad.
Hip and thigh king.
Pulse is gone.
Subclavian is the stele.
Brain to the arm. BP gap
Is the alarm.
Excellent work. Syndromes locked: the Leriche Triad and the subclavian stele. We've mastered these specialized pipes, and now it's time to put the entire vascular map together. So make sure you subscribe to Clinical Crash Course and join us for our series finale, Module 6, Rapid Review and Vascular Decision Tree.